It's Catherine. I wanted to share with you today what I've been doing for pharmacology. I'm getting a low A. This last test I didn't do very well. There are two tests I didn't do really well on, but one of them was just couldn't figure out how to organize the information to study it. The other one was my most recent, and I just did not put the time into it that I should have because I was trying to finish my online class, which I finished, got an A. So I think it was worth it. Um, Anyway, I started out with our pharmacology. We don't get an outline or anything, but she does give us. We do have our schedule of what to read, and the nice thing is that she tells us what each class, how many questions are going to be on our exams, and then she also tells us how many are going to be on the final. So when we go back for our cumulative final, we know where to put a lot of emphasis. However, most of them are like one or two questions, so we kind of need to study it all. But I started out most of the classes that I've taken in the past, I've done really well with printing out the PowerPoints and just taking my notes on them. But I also have a separate notebook that I jot down my own hand notes also. But if there's something in the PowerPoint that I just want to mark and say, oh, teacher kind of emphasized that, then that's what I do. And that worked really well for our first exam. It was very easy. I also made flashcards so that I could carry them around wherever I was to look at them. And I did great on that first exam. And then the second exam, I really got tired of using so much paper because that 2 slides per page comes out to a lot of paper that gets used because you go through so much in pharmacology. So then I started just doing 4 slides per page and taking my notes that way, still having my other notes. That exam was the diuretics, the anti-diabetic medications, vitamins and minerals. I still did really well on that. In fact, I actually, some of them, I printed them up like this so that I would have the little lines to write on. But then we got to our heart failure drugs, and it was heart failure, anti-anginal, there was something else, but there were so many of the same, like beta blockers were in, I think, all three of them, but not the same beta blockers were used for each thing. And I just couldn't come up with how to get it organized. So I didn't do terribly well on that, but I'm getting there. So then the next 3 tests, what I did was I went back and typed up my notes, kind of typed up the PowerPoints, and you know, gave the mechanism of action, what they're used for, contraindications, adverse drug effects. If there were any big cautions, then I list out the medications and then the nursing implications. On this test, there were a lot of corticosteroids, and so I tried to make up little stories or mnemonics that went with it so that that would kind of help me remember, oh, wait, this is, used for antihistamines, or this is used as a bronchodilator. Not just the list of medications, but where they went under so that I would know, okay, we're looking. The question had to do with their breathing, or, then I knew exactly which corticosteroids. So that's what I did, and I printed up and I typed up each PowerPoint separately. And then I have these folders that I keep them in my notebook. And so there's usually 5 or 6 PowerPoints per unit, and so I just put them each in their own pocket. And then I spend my time studying each PowerPoint, and then as I get closer, like that weekend, I should be able to go through all of them pretty quickly. And then after the test, I take them out and put them all in one. So then when it's time, well, in fact, I'm working on it now, studying for the final, I know, which test, every exam is all in one pocket. So I'm doing pretty well. That seems to be the way that's working best for me. Also reading the chapters when I've had a chance. The first test I did amazing on because I also read the chapter, but I'm a very slow reader. And our book is from Elsevier, um, and they have online resources. So they have about anywhere from 8 to 12 practice questions for each chapter. So I go through each of those. That kind of gets me in the mindset of how the questions are going to be, because nursing test exam questions are not like anything you've ever seen. It's not just a, this medication is used for this, but they're going to put the patient into a scenario, the medication into a scenario. Nursing implications is huge. And if you understand the pathophysiology and the mechanism of action, it really should help a lot with the nursing implications. This next exam we just started, and it has thyroid medications, and it was so easy. And she said, we have thyroid replacement and antithyroid, and adverse drug effects are for thyroid replacement. Adverse drug effects, are you seeing antithyroid, high hyperthyroid um, symptoms and effects? And so it really comes down a lot to understanding the mechanism of action and the pathophysiology. I know some programs, our program, you didn't have to take patho to get into, but I'm doing the bridge program. I have a Bachelor of Arts, so I'm bridging into a master. But I'm working on my ADN, but my online classes are my bachelor classes to get into my MSN once I've graduated and got my license. So anyway, I had to take patho to get accepted into the master's program, and it has helped a ton. I know a lot of people have taken it online and they said, well, they didn't really learn anything because they just wanted to get it done. And that's how we do a lot of times with online classes, which is a shame. I really like being in class in person. I feel like there's more discussion that happens. It sinks in more. There's just so much more interaction. And you with all that interaction, you focus more, you try to learn more. But with the online classes, I've had some really good ones. This last one was difficult, trying to understand what the teacher wanted. And it's hard. I mean, we've all seen it in texting. You text somebody something and they take it the wrong way, or they just don't get what you're asking. And it's the same with emails. And it took several emails to finally understand what the teacher was looking for in a paper. So I did well once I got there. So that's one of the issues with online classes. And I think patho is so important to understand. There was one person in my patho class that kept saying, can't you tell us what the treatments are? And she would give us a little bit, but now that I'm in the nursing program, I understand that's not her job. Her job is to help us understand what can go wrong. And then we get into the nursing program to learn how to treat it, how to take care of that patient. But it has helped immensely with pharmacology, the parasympathetic and the sympathetic nervous system. Holy crud, those are so important for so many of the medications. And our teacher really harped on that. We spent a lot of time on pH balance, and of course that is big with the diuretics and understanding why you've got potassium sparing ones and why these can cause these adverse drug effects. Cardiovascular, I'm very interested in the cardiovascular system and in cardiology, but I really struggle for some reason. But I think I had a difficult teacher in my anatomy and physiology when we went over the cardiovascular system, and so I got really frustrated. So I didn't learn like I should have, and I still am anxious to find some time to sit down and study that more closely. But anyway, what I did get out of my patho class helped me a lot with a lot of the cardiovascular drugs we've had. Now we're headed into the like Parkinson's and what else? I forget, that we're going to look at next week. So I'm trying to type up my notes right now from this week's lecture and try and get on top. And the first 3 exams that we had, I didn't have my notes like this, so I'm going to work on that, and that will help me review and hopefully should be able to get an A in the class, but like they say, C's get degrees, but I'm not going to get a C. And it's so important for me, not necessarily the grade, but to just know as much as I can because I owe it to my patients to be the most knowledgeable and confident person because I've had very, I don't know what the word is, not inconfident, but I've had people who just really didn't know what they were doing treating me, and it made me insecure and made me not want to go back to that physician or whatever. So I don't want to be that. I want to be someone who brings patients back because they're getting the right care. So anyway, this is what I did to say for pharmacology. If you have any questions, just drop a comment. Let me know what you think. If there's something else you would like to know about, I'm still trying to figure out nursing process, but I'll be working on that. And I'll probably check in maybe at the end of the semester because I've got a lot to study. Don't know if I'll be able to take the time. But anyway, if you have any questions, just want to maybe you have some advice for other people on pharmacology, put that in the comments so we can all learn together. And I will talk to you soon. Bye.